Hello and welcome to another episode of Sassi Talks. I'm Savahna, your host, and on today's programme we have Dr. Lucy Foulkes, who is a psychologist at University College London, and she's also an author and a writer. She's recently written a book which launched earlier this year called Losing Our Minds, which goes into the misconceptions around mental health, what it is and what it isn't, and helping us to better understand how we can recognise signs and be more sensitive to both ourselves and those around us. So, Dr. Foulkes, Lucy, as I'll refer to you from now on, thank you very much for being on Sassi Talks.
Thank you for having me.
Well, do you want to jump straight in and just give us an overview of why are you studying psychology? Why the focus on mental health?
Yeah, sure. So, I've studied psychology since since A-level actually, and then undergraduate. And I was always personally most interested in, what happens when our psychology goes wrong, I suppose, in inverted commas. So I was always interested in the clinical psychology side of it. And then some slightly chance interactions and work experience got me on the path to doing a PhD in this area. And I now study and write about mental health full time.
I get the sense that mental health is being used so much now, and people say I have mental health, and without really having an understanding of what mental health really is. And that's what I'm hoping we're going to be able to really address in this programme. But what are the different types of mental health, if you like, in terms of clinical and something that is potentially something that as individuals we can manage?
Well, so this is exactly kind of the question that I wanted to lay out and answer in the book, because we're talking so much about mental health, mental illness now, which is broadly a good thing, but I think there's still a lot of misunderstanding. We have quite a sort of shallow understanding about this topic across society. And one of the things I wanted to lay out as clearly as possible was to map out the fact that there isn't a straightforward sort of distinction between people who are psychologically well, mentally well, and people who are mentally ill. Actually, there's kind of a spectrum. So if you take something like low mood, you'll get all different shades of that. So you might have a kind of mild low mood sometimes, gradually increasing to people who kind of have chronic, serious low mood that means that they can't function. But it's very much on a spectrum, so there's not kind of two clean-cut groups of people. And the fact that it is this spectrum has led to some confusion about, what counts as a problem and what doesn't.
And how much of it would you say is genetic and how much of it is social, is our environment, our circumstances?
So it's a really big question, an important question. It's basically a bit of both. Some people kind of exclusively study the biological side of it, and some people study the environment side of it. Essentially, like everything we do and feel and think, it's a bit of both. So your genes and your biology will set up a potential vulnerability to having mental illness. So, for example, if your parents or other relatives have depression, you'll have a genetic vulnerability, so an increased risk. But it's not a kind of destiny. It's not guaranteed. So generally, that means if you have this underlying risk, it might then be triggered by something in the environment. And certainly we know from all kinds of studies that all kinds of stress and hardship and difficulty in your life will increase your risk of mental distress and mental illness. So it's both, essentially. But generally, there's something that triggers and sets it off. It doesn't need to be something monumental that we might think of as a kind of serious trauma. It might even be, a period of exam stress, for example, that happens to a teenager. So they've had this kind of underlying sensitivity to being depressed or anxious, and then they reach a point in their life where they're under a lot of stress. It doesn't have to be anything major. It varies from person to person. But generally, my understanding and my experience is that there's something that starts it off in the outside world. I think if you speak to most people who've had experience of these problems, they would say that they can see something that sort of set it off. The only exception to that is maybe when the trigger is more biological. So, for example, some people argue that schizophrenia begins because something there's a kind of aberration in the way the brain develops in puberty. So that trigger wasn't necessarily something in the outside world, but there's some shift that happened that then set off this kind of underlying vulnerability that this person had, this underlying predisposition.
So let's break down the study that you're looking at then.
Mental illness, the way I interpret and talk about it, is when your thoughts, your feelings and your behaviour start to operate in a way that causes you difficulty. So generally that difficulty is defined as either you find it upsetting, distressing, and or it affects your ability to live the life that you want to live and that you should be able to live. So generally one way that people figure out whether something like low mood is becoming a problem rather than just kind of part of life is how distressing do you find it? How difficult do you find it to control? How long is it going on for? But also how much is it preventing you from living the life that you should be able to live, stopping you from having relationships and jobs, for example.
So the spectrum, but just go further with it. So, this is what you're looking at. What is the spectrum? Where do you draw the line between somebody with low mood, somebody with a serious condition that they need to seek medical help for, or that they need medication for? Or how do you sort of position yourselves to really try to get an understanding of the misconception of it?
So this is exactly what I really wanted to lay out in the book, is that there is no line in nature. There is no point on that line that exists in nature that says this, beyond this point, you have low mood that's part of depression. And just before that point, you just have regular low mood. So researchers and doctors and academics have had to kind of make an educated guess about the point at which it might be sensible to say this now counts as depression. So this is now the point at which we should maybe talk about medication or consider referring the person for counselling. But really it's not, and it moves. Like if you look across the last 50 years, the point at which that line begins has changed and it's become more and more loose. So more and more things are now considered to be depression than they were 50 years ago, for example. But really, if people are wondering about themselves, it's what's more important is to make a judgment about how distressing are you finding it? How much is it stopping you from doing the things that you want to do? You know yourself best. If it's something that you're concerned about, go and have a conversation with a professional, because there's not a clear-cut line in the sand about what makes you worthy of getting external help.
In terms of categorizing the way you feel as saying that you have depression, how does one wrap their head around that?
This is the really interesting thing about these labels and the fact that there isn't a clear set of guidelines in nature. It means there is some flexibility. So if, for example, you've broken up with someone and you're finding it really difficult and struggling with your mood and lack of motivation, etc., you're in a kind of grey zone of whether that counts as depression or not. So if you find that brings you meaning and that's helpful, a helpful framework for understanding your distress, then there's some flexibility if you want to take on that term. But equally, if you think, oh my God, not only am I really struggling, but I'm also now depressed, I have this, there's something wrong with me, there's something wrong with my brain, I have a disorder. If all of that feels very heavy and frightening, then be reassured that you don't have to take on that label unless you find it useful, because these are sort of very flexible terms. At the extreme end of these symptoms, this extreme manifestation of depression, PTSD, OCD, for me, it's so explicitly obvious that people are suffering so much that it's useful to use the word disorder. But there is a movement, there are individuals who think it's never useful to use the word disorder or illness, especially when it's happened as a result of hardship. If you have a refugee who's been through all kinds of trauma and is now having feeling, has poor housing, no job prospects, and they have low mood, reasonably some people would say it's ridiculous to say they have a mental illness. Actually, they're just responding in a very understandable way to their environment. So again, there's flexibility. If you don't think it's useful to frame your suffering in that way, then you don't have to.
I would imagine that if somebody has gone through something that's quite traumatic and they've decided that they've got depression, that probably compounds the situation and makes them feel even worse. And I guess a mental feeling that you don't have an issue or an actual condition, but you're just trying to deal with something, will make it perhaps easier to overcome.
Yeah, well, that's what is so interesting in the person, because you're absolutely right. Some people will respond in that way, that, it would just be an extra burden to take on the idea that they're depressed. Other people will find it really relieving and clarifying to be told and to recognise that they have depression. The benefit of these kind of labels is that it alleviates a lot of personal responsibility. There's a sense that, it's not my fault that this is happening. This is a disorder that I have. It's very common. Lots of other people have it. There's lots of ways to treat it. So again, it just comes back to, what does that individual find most informative for their circumstances?
And what might be the ways to manage it, to come through it? Because I would imagine as well that a lot of the time there are things that we can do ourselves.
There's lots and lots that people can do themselves if they're well enough. You can teach yourself a reasonable amount about basic therapeutic techniques like CBT and mindfulness. There's lots of good books out there. I'm also a big advocate of using the body to manage your mental health. So, for example, by exercising, I think if you're able to, and if it's not part of the problem, then doing exercise for half an hour or an hour can completely transform your mood or your anxiety level without actually having to engage in any kind of intellectual thought changing. But just by changing your body, the state of your body can actually have a really powerful effect on your mind. Another thing I should say as well that often gets lost a bit in these conversations is the power of social support, if you have it. The incredible power of spending time with people that you love and care about and have fun with, either talking about the problem or not talking about the problem. But, I think sometimes we miss the piece of the puzzle. There's so much part of the conversation now is what we're supposed to do to solve our problems ourselves, when actually the people around us can be a really powerful tool as well.
That's a very good point. So what would you say are the key takeaways then? What are the key things that one should realise or have an understanding of from your book, your key takeaway from that? And also the key 3 things that an individual could do if they themselves feel that they are suffering with their mental health?
Yeah. Oh, okay. So the takeaway from the book really is that the topic of mental health and illness is a messy one. And part of the messiness comes from the fact that all these symptoms like anxiety, low mood, intrusive thoughts, whatever it might be, exist on a spectrum throughout the population. So there's not well people and ill people. There's lots of people in between. And recognising that, I think, is the first step to understanding ourselves better and reassuring ourselves often. A second takeaway from the book is that there's sort of humanity in suffering, I suppose. Sadly, it's very common to have periods of mental distress or unhappiness. Doesn't necessarily mean there's anything wrong with you, or that it's something that can be fixed or should be fixed instantly. This is kind of the flip side to all the good stuff in life. It's it's part of being alive. Unfortunately, it doesn't mean you just have to put up with it. But I think it's important to recognise that we will all have periods of difficulty sometimes. And then the takeaway point about what to do. The number one is, if you're worried, if you know yourself, and if you know that you're struggling or you feel that you're struggling, absolutely go to a GP and talk about it. It's not just, as with physical disorders, it's not on you to make the call about whether you need extra help or not, or what you might need. So if you're worried, absolutely go and speak to someone. If you find one GP isn't helpful, then go and speak to another one. There's a huge variety in terms of how people respond to mental health stuff. And then to explore for yourself what's useful for you. So people vary so much in terms of what they find useful for managing their mental health, whether that is seeing a therapist or exercising or spending time with friends, or, getting a book about CBT and doing some exercises, downloading a mindfulness app. Some people love mindfulness, some people don't get on with it at all. That's fine. You don't have to like it, but, it's something that you could explore. And the third takeaway point about what to do is, I would say, recognise the power of time passing. Doesn't mean you shouldn't look after yourself in the interim, but a lot of mental distress and difficulty just naturally passes with the sort of transition of time and circumstance. So look after yourself while it's going on and get extra help if you need to. But sometimes it's a case of waiting it out to an extent, looking after yourself while it's happening, but knowing that things are shifting all the time, and often things just do get easier simply through the passage of time. And that's a comforting thing. That's a good thing.
Yeah, that's a very valid point, actually, to help people not feel like they're stuck in this indefinitely, but actually time is a great healer. It always has been. So, well, Lucy, thank you so much for being on Sassi Talks today and giving us that insight and that perspective on this and around mental health. So thank you very much for that. And if this is your first time watching Sassi Talks, you're very welcome to the show. You are invited to follow us on YouTube and subscribe to our channel, where you can follow and see more programs like this and receive our insights and wisdom as we go through the series. So thank you very much, and thank you, Dr. Foulkes, again for being on the program.
Thanks for having me.